Hello and welcome to the Practice Marketing Podcast, highlighting successful strategies from North America's fastest growing clinics and experts so you can learn from their wins and power your practice growth. I'm your host, Neil Trickett, CEO of Practice Promotions, and today's focus, we're going to be talking about Google Ads and also with Trilogy Physical Therapy and Medically Orientated Gym. And we have with us Jessica Robbins, who's the marketing liaison there, and Sara Samland, who's the Chief Operating Officer. And they're part of the team behind Trilogy Physical Therapy and Medically Oriented Gym, which is a fast-growing practice with 6 locations across Western New York. And they're combining expert care with fitness through their medically oriented gym model and also getting amazing results with this. So if you're looking to grow your practice, this one's packed with real-world strategies in this podcast, and we'll dive into how they manage their company, things that they've grown over time, why they chose to work with Practice Promotions as their marketing partner, and how Google Ads have helped them to bring in more new patients. So Sara and Jessica, welcome to the podcast.
Thanks for having us.
Thank you so much. Thanks for having us.
All right, so let's dig in here. You guys have a really cool approach here and service lines that you added to your practice. So Trilogy is really unique in that you have this medically oriented gym as part of your practice. And so what does that entail? What does that look like?
Yeah, so the medically oriented gym, and we consider it and call it a MOG, M-O-G. We have and offer traditional fitness services, but also non-traditional fitness services. So from the outside looking in, we have an open gym concept for anyone to come in and use all the equipment. We offer group exercise classes. We offer personal training, but because we're medically oriented, we also have a ton of what I would consider non-traditional fitness services. So we meet with all of our new members who come in, whether it's from physical therapy or off the streets. We have an extensive medical history, and we do a health evaluation when they first come in. And then we work with them in whatever way, shape, or form is really needed. And so we offer what's called a medical membership, where our staff, for example, if somebody has some cardiovascular disease or some pulmonary dysfunction, we can work with them in a safe way, monitoring their blood pressure, monitoring their heart rate, their oxygen levels, and make sure that the exercise is really appropriate and the movements are appropriate for that individual. So we do, blood pressure tracking. We do something called restore sessions, which are a manual stretch and some Theragun and some lower extremity compression sleeves. So we're really set up nicely to cater to the healthy, motivated population, but then also some unhealthy or maybe even unmotivated individuals, just with a safe space and some staff who are really qualified to help them.
That's amazing. I'm curious, did you start off as a physical therapy clinic or more as a gym, or like where did you guys start?
Yeah, so we started as a physical therapy clinic, and actually, our founder is a physical therapist, and he had a single site location in Western New York. And really, he came up with the idea because a lot of his patients that he was treating had comorbidities, right? People who had back pain, knee pain, were overweight, obese, and really needed some lifestyle management. So that was part of the reason and part of the idea for him to open up a medically oriented gym in tandem with the clinic. And then there was also really no safe spot that he was comfortable, after those patients were done with their formal treatment. There was nowhere for him to send those people. So he just thought, well, what if we keep those patients and we're able to help them, and we have a little bit more appropriate staff to be able to help them, musculoskeletal wise, orthopedic wise, but also chronic disease wise. So that's how the ball came about.
That's
Came about.
amazing. And then what a visionary, because I think that we have such an opportunity in this profession to expand into so many areas to serve the public. And if you think about the traditional physical therapy model where someone gets injured or they're having a chronic pain, they come in, we see them for 10, 12 visits, and then we discharge them. And I can tell you as a PT, like there's so many times when you discharge a patient, you're like, you need to keep going, you need to keep doing stuff. And here's some things that you can do at the gym, or go see a personal trainer at the gym. And we just kind of let the ball go, right? Where you guys have really seen the potential there, which is what we should tap into as a clinic, is that how do we continue to service these people long into the future and help them along that journey? And what I really like too, what you've done with the medically oriented gym, is you've taken that population of people, which is a very large population of people in the United States, that have comorbidities, right? They may have diabetes, right? They may have cardiovascular problems, and they have a lot of struggle going to a regular gym, and they won't do very well with just a traditional personal trainer at the gym. And so what happens to those people? Well, they just keep living their life, and they, have more troubles down the road. So I love that philosophy of you have both the medically oriented gym for the more sensitive public that really need more hands-on care in their gym, and then obviously the fitness lines there that you have for more active adults and athletes and things like that. So I'm curious there too, is as you got the medically oriented gym going, is that something that you've seen help build physician relationships because you have something quite unique there?
It is, yeah. So, really, is part of what we do also on the MOG side is we send, similar to what PTs do, sending progress notes and reports. We actually send the same thing on the fitness side and the MOG side over to primary care specialists or any other specialty provider. So we're sending those notes over, as long as the member wants us to send them over and to keep these physicians in the loop to really go full circle with their health, right? Like we
Hmm.
want the physicians to know what they're working on, what we're doing, what the patient's goals are, how we're helping achieve those goals. So we want to make sure that we can, stay as communicated as possible to all of the right and appropriate providers. So yeah, and really what we've seen is great success from the people who have committed. And so primary care physicians see that and acknowledge that and do send over referrals because they want their patients to be managed in a better way. So
Yeah, I just think that's a win-win, and most doctors would probably not know about something like that until like they get a few patients going, like, oh wow, there's this opportunity to help my patients, and I'm always telling them to go exercise, right? Eat better,
right, right.
exercise, right? And but where do they go, right? And so you have a place for them to go. I love that. So I think it's a wonderful model. Again, as we look at the opportunities that are there within the publics we can serve, that's a huge one, and I think that's you've kind of really hit the nail on the head with what you have there. Um, so I'm curious, as because can you tell us about some of the other service lines you have? So the medically oriented gym, and then you have some fitness programs. What other kind of service lines do you have in the practice?
Yeah, so we have other specialty services. So we have lymphedema specialists. We have three, so we have six locations. In three of those locations, we do TPI golf programming. We have aquatic therapy at two of our locations. One's at an aqua treadmill, and the other one is an actual therapy pool. So a bunch of different services. We have a pelvic floor therapist, and in our area, lymphedema and pelvic floor, there's just it's such a need into the community that really like unfortunately we have long wait lists for those services. But yes, we do, other specialty services other than, your general orthopedic or
Mhm.
musculoskeletal treatment as well. So,
Got it. And so with those things that you just kind of naturally added on as time progressed with the clinic?
yeah, so it really like some staff or employees have said that they're interested in kind of these different service lines or treatment areas, and we've encouraged people to go for it from a continuing education standpoint, certification standpoint, and they're passionate about treating these certain conditions or for these certain populations with golf, and so we've really tried to support them in that way, and have luckily been successful because they really are great at it. So.
Hmm.
And we actually have also we have a provider who is very tied to the Parkinson's community locally. And as Sarah mentioned, it was an area she was passionate about, and she actually went on to become certified in LSVT Big, which is a specific treatment plan for Parkinson's patients. So that's been really neat to see just like that relationship develop and the relationship with her patients and whatnot. So
Excellent. Yeah, and I think for our audience out there, if you're just doing more traditional outpatient orthopedic, PT, it's you can think outside the box, and I think it's great growth opportunities for your staff. And again, we look at staff retention today is a big thing. So if you have staff that have an interest in a particular area, how could you develop that into a program? right? And it kind of seems like you've done some of those things as you've had people say, hey, I'm interested in Parkinson's and neurological patients. How can we develop more of a program for that? So I love what you've done with that. And I'm curious for like the medically oriented gym and some of these other service lines, is that something that is covered by insurance, or is it more of a cash pay service? I'm curious how you bill for that.
Yeah, so both, right? So a lot of the services are cash-based services, but what we can do for any type of health and wellness benefit through their health insurance, we accept any and all. So we certainly encourage people to use that if they have a FlexFit card through their health insurance. A lot of the Medicare replacement plans, of course, the silver sneakers, things like that, do help cover some of the costs of the MA, kind of a subsidized plan, if you will. But there is an out-of-pocket cost as well to some of the services.
Yeah, and that I mean, again, that's I've talked about this a lot. Where as clinics in today's insurance world, we know that we have to pivot, right? And we have to look at how we have this hybrid model between insurance and cash-based services. And again, I think you've done something excellent here, which is you created programs that are really needed and beneficial, but you've made those cash-based services, and then you can supplement. I like I like those kind of programs too, because you're talking about quite a few of these insurances do have flexible benefits attached to them, so like the patient feels like they're able to use part of their insurance towards that cash service. So that's really smart. Um, and so I'm curious, if you don't mind me asking, like as a percentage of clinic revenue, how much do you see come from your cash-based service lines to the insurance side?
Yeah, so we still are very heavily insurance based. 85% of our revenue does come from insurance based, but then there's an additional 15% that comes from the cash base, which is great in my mind. I mean, the 15% is amazing.
Hmm.
We don't want to rely entirely on the insurance. And if you know anything about Western New York, it's a terrible, terrible reimbursement region.
Hmm.
So it helps, right? It helps in the bottom line and with our revenue and income, definitely.
Yeah, excellent. And yeah, I think that's where a lot of clinics are trying to get to, is usually like a 80/20, right? Where you have
Yeah.
like 80%, and but that 20% could be significant, right? And you don't have to have as much cost towards, I mean, I know some clinics in Florida that are doing, 400, 500,000 in cash services for different things as they're coming through. So that can be a significant boost to profitability in the business because of these additional service lines that you have. So if a practice was to look at putting a medically oriented gym into their lineup, who manages that? How does that work?
Yeah, so for us, we do have a fitness director, a medical oriented gym director. So out of our six locations, five of them now have a MOG component. So that individual oversees, all of the day to day, kind of what's happening at each of those locations. And so, which is really great because we do have some separate, we have some hybrid staffing in terms of some PTAs who do the cash-based services, but we also have some dedicated exercise specialists
Hmm.
that do programming. And so it's really flexible and dependent on each location, but we do have an individual who oversees all of the components of it.
Excellent. And so the people who are helping the patients through the medically orientated programs, are they PTs, or are they more like exercise specialists, kinesiologists, what type, or personal trainers? Like, what do you typically like? How would someone run that?
Yeah, so they're either PTAs or they have bachelor's degrees in exercise science or kinesiology. Some of
Hmm.
them have the clinical certified the exercise physiologist certification. So they have to have at least, if they're not a PTA, at least a bachelor's degree in a related field. So again, a little bit more qualified to our patient population.
Yeah, that's good actually, because I think um, you can have someone who's quite skilled. Obviously, you don't have to have the high expense salary of like a PT to deliver that kind of care, and then you can keep the costs relatively good for the patients there. Um, and I'm curious. Obviously, we know there's such a shortage of PTs and PTAs, but I'm curious, is it like a little better for exercise physiologists or, these kind of, fitness skilled practitioners?
I will say it's not, because a lot of the students who are coming out of school and who have been coming out of school for years really use the exercise science degree as like a first step into healthcare.
Uh-huh.
So unfortunately, I know you mentioned staff retention before. It's always been an issue with our exercise staff, because a lot of them do go on to PT school,
Hmm.
or one of them. We just lost someone. He wanted to become a respiratory therapist.
Okay.
So they really use that as kind of a baseline degree before continuing on in the healthcare field. And I think we're going to see that for years to come. I don't see that getting better anytime soon.
Got it. Yeah, but it does give you different options, right? So you're not so boxed into just having a PT run it, right? So I think
Yep.
if you're a clinic and you're thinking, hey, this could be a good idea if I added a medically oriented gym, or if I have a gym, could I add this kind of program in there? And the kind of people that I can have it run it are very skilled, but I can have a bit more range of people that I could attract, but I might have a bit more turnover just because it's sort of a stepping stone into a further, healthcare career. But I really like the idea of what you have there.
The top 10% of PT owners aren't just surviving, they're thriving. But what's their secret? Well, Neil Trickett's new Market to Grow book reveals how the top 10% of PT practices leverage marketing systems to simultaneously grow their new patients, attract top talent, and boost profit in their practice. You can learn from their secrets. Visit practicepromotions.net/book to claim your free copy of Market to Grow. Yes, you heard that right. We are shipping a free copy of Market to Grow to all podcast listeners who want it. Just visit practicepromotions.net/book to claim your free book. And now back to the show.
You have some of the mentioned like silver sneakers programs and things like that. Do you get people come in that aren't necessarily maybe they're more elderly, but they maybe don't have as much comorbidities, and they come in for like the silver sneakers type programs?
We do. Yeah, yep, absolutely. We have people who come in and just want to stay healthy and exercise and socialize. I mean, socialization is huge, especially within the Medicare and our Silver Seekers members. So, definitely, yeah, you don't necessarily need to have something going on in order to come and use our facility. But we do have people who just come in and want want the different services. So,
Yeah, that's great. And obviously that generation really loves to talk with each other.
yeah,
So I'm sure you get a lot of word of mouth referrals just from
yeah.
people coming in and seeing what you have available to help them, right?
Yes, we have like people who are in the same quilters guild and people in the same parish at churches. So now we have our own little like micro communities within some of our group exercise classes too. So
Perfect. Yeah, it's the way to build it, right? And so I'm curious, since you have these different lines in there, you obviously have golf fitness, personal training. I think you have nutrition counseling also. Is that right? Um,
we do, yep.
so I'm curious, like, do you see a lot of like cross referrals, internal referrals happening within the business because of that?
Absolutely. Yeah. And so one other service that we offer for our members are called red flags or free screens. And so, if anybody's having any type of pain or discomfort at any time, we'll put them with a physical therapist for 15 or 20 minutes, and they'll do a little mini screen and kind of evaluate them and say, it could be this, you could benefit from treatment, let's look into this further.
Mhm.
And then vice versa, right? Once our physical therapy patients are done getting formally, skilled treatment and therapy, we transition them onto the MOG side. And then if they need a nutrition component, we do the nutrition component. So it's really full circle. We try to set ourselves up as kind of a one-stop shop for all health and wellness and lifestyle management. Obviously, sometimes there are times where we need to refer out to a registered dietitian if they're a little bit more complex or have some things going on that we don't really want to intervene on medications, for example. But we do, yeah, we do really try to work together as best as possible to manage our people in our facilities.
Yeah, that's fantastic. And I think that I've seen it's interesting because I've seen a lot. Your model is more unique than what I've seen out there, but I have seen in, say, like more in Canada than in the US, where there's more of like what you said, that one-stop shop. And people love going to those places because they know there's a lot of options, right, that could help them with their pain or problem. And I think when you can incorporate different service lines, whether you bring in acupuncture, massage, nutrition, personal training, like whatever it may be there, I think if you look at it as a holistic approach to getting someone better, what other service lines do those people need to get better? And again, I think just kind of looking with the public that you have, there's especially if you're treating people with more comorbidities, they're going to need times when they need more therapy, right? So that's a great referral over to PT. And I love what you do there. You called it a red flag. Is that what it is when they come in to do a screening?
Yeah, like a red flag assessment. Yep.
Yeah, I love that. Yeah, so we offer a lot of times we offer in practice free screens anyway, right? But can you incorporate that as part of what you're doing internally within the clinic side? Fantastic with that. So, since you've worked through a lot of these different service lines coming into your practice and building out those programs, I'm curious, do you have any advice for other practices who are kind of thinking about setting up cash pay services or memberships in their programs?
Yeah, I always think if there's a need with your consumers, your community, your patients, and if you have staff who would be interested and passionate about running some of those different services or programs, there's really no reason not to. Those are the two main things that you need. Even space-wise, people have asked us, well, my clinic is small, I can't necessarily do it. I don't have a lot of space. One of our locations is very small, and we are able to run services out of it with a PTA. So really, those two things are critical, and everything else are small barriers in my mind that can be overcame very easily. So.
Mm-hmm. Awesome. And so let's talk a little bit here about attracting those type of patients and obviously new patients to the practice. So Jessica, I'm curious to you, let's talk a little bit about Google Ads, and obviously you've worked on those, worked with our team on that. And so what role do you find Google Ads have helped you play in patient acquisition in terms of strategy and the results, how that's changed over time?
Absolutely. We are still kind of early on in the process, so it's about month 4 or 5, but we've already seen really great results. Implementation went very smoothly. But because we have 6 different clinics across Western New York, we, over the past few years, have noticed that at one time, maybe one site volume is a little bit higher than another, and they kind of flip-flop, so we've had to spend time every month just kind of keeping track of that, or maybe shuffling our priorities, which is a time constraint. So one thing we were really hoping for out of Google Ads was to find more of a happy medium and more consistency. With that, and with also having 6 different practices, our practices are unique in the services that they offer. Some of them offer certain services, some of them don't. But they're also in very unique communities as well. So like we notice within the 6 different regions, as we call them, there's very distinct differences. So the nice part about implementing Google Ads is that we can really highlight those characteristics and those services and play to their strengths. So it's been nice to kind of paint a very distinct picture of each of our clinics for those specific communities and have that, have that freedom to do so.
Mm-hmm.
And I guess
that's an excellent point. Yeah.
Yeah. And one other component I think that we've found very useful too is just the quality control that we're able to do. We're able to have a pulse as to what needs are coming through, the phone calls that are coming through. So the new launch pad that is now associated with Google Ads too through Practice Promotions has been very helpful. It just from an internal standpoint also.
Mm-hmm. Yeah, so that's just one of the things we're thinking with Google Ads. So we talk with different people. Some people are new to Google, thinking about Google Ads, and they haven't done it before. And so for those folks, I think one thing to look at is how people behave when they search. The more that you're all over page 1 of Google in their search, the better. So you have 2 spots that you can actually get with Google Ads there. One is at the very top, and then the other part is at the top of the map section, of the local section. And then, of course, you could be ranking in the local section and the organic section. So you could technically have 4 spots on page 1 of Google, and then people are thinking, hey, this place must be the best, right? So that's what you're shooting for. But I love what you talked about there, where you can really dial it in to each geographic location? Because we all know that there's nuances in different towns and cities, and how people might be in, the things that they might gravitate towards in an urban area versus a bit more rural area, right? And then you can match that too with, say, the programs that you have in certain locations or and not in other locations. So I'm curious for you, Jessica, have you found certain types of keywords or campaigns or conditions to work better than others so far?
So I would say overall, we still see a really strong association with things like, lower back pain or certain more ailments necessarily. We see like a really strong capture in terms of that. But when it comes to the more specified services like pelvic floor or things that we do specialize in as compared to, other practices maybe, we also have seen a pretty, a nice association with those as well. So I would say for the most part, it's condition based,
Mhm.
but those more specific services, we definitely see a high association with, which we've been happy about.
Yeah, excellent. And so I think that again brings back the point that you want to use ads for your low hanging fruit, which is people looking for physical therapy near me. But then you could go further with your budget too and really tap into people that are looking by condition. And if you have those awesome programs like pelvic health programs, or, in your case, because people are maybe not that familiar with a medically oriented gym, but they say, how can I exercise to help with arthritis or diabetes or cardiovascular? You could have searches, you can show up for searches there with using ads on those particular types of conditions. And now you're getting in front of people that weren't even thinking about you before. So it really opens the gates a lot wider for you with that.
Sure.
And so if with what you're seeing there, how you're targeting things, you're starting to leverage Google Ads more with that. What advice would you give to other clinic owners thinking about investing in Google Ads if they haven't done it before?
So I mean, we've had a really great experience, so definitely recommend it. But I would say that overall, Google Ads can be very effective, especially depending on how you leverage them. But they can also be something that's very tricky to manage independently. So I really believe that the success of our Google Ads is tied to the person managing it, which in this case is Justin. He's done a phenomenal job. But if you're someone like me that does not have that background knowledge, you want to rely on someone that does. So practice promotion has been very, very helpful just in helping us, like I said earlier, paint a picture of our unique clinics. And it was really effective to sit down with our, account associate to really discuss the nuances and the characteristics of our practices so that he could better translate that into something that would be served through a Google ad and be effective. So there's that teamwork component, and it's just taken a huge strain off of our team, and also it allows us to be really nimble, which at times is something that we've definitely seen we need to be. So,
Mhm. Excellent. Yeah, and that's a lot of what we do, right? Is that we actually, if you're a clinician, a PT owner, right, and you have multiple provider clinics and you're trying to run all the marketing yourself, like you can't do that all yourself, right? And you can't figure out all the complexities of Google Ads. You can run Google Ads, but doesn't mean that they're going to be good or that effective, and you could waste a lot of money doing it yourself. So that's where leveraging help specialists can really get you more bang for your buck when you're doing it that way. And then, of course, we work with clinics like yours that have, a marketing liaison in there, or we even work with a clinic that's 160 locations that has multiple marketing people within that organization. And at that level, and your level, you've got so many things that you need to market. You can't do everything yourself, right? And so being able to have the vision, knowing where you need to go for marketing, but then leverage like our team to really help support you. And again, we're working together on strategy, but then the technical stuff behind the scenes is what we can really help support you with and make sure that you're getting those best possible results out of Google Ads.
absolutely.
And so I'm curious, just from a personal perspective here, there's a lot of marketing, agencies out there and a lot of choices for marketing. So I'm curious, what made you choose Practice Promotions when you started working with us?
Yeah, I can at least start this and then Jess can end this. So, like you had just mentioned, we were in the past trying to do it on our own. Marketing, our website, we were trying to do it all internally. Our social media, we were trying to do internally. But what happened was we were just trying to do it, and it always fell to the back burner. And really, what we needed, I think our first step was actually realizing that we needed a full website revamp, and we needed it to also, bring in leads and referrals for us. Our digital space was doing nothing for us at the time. So we were referred to Practice Promotions, and that was our first goal, was to at least, make our website better than what it was. And then slowly but surely, you guys have added features, and we've used, the email campaigns. We've really put everything through Practice Promotions now, which is great because it's kind of a one-stop shop for us. We were using Breakthrough, which I think you're very familiar with Breakthrough as well, and doing some marketing through them and social media and obviously the workshops. And at the end of the day, it was really great for us for a long time, but it just became not as effective. And so we said, this is a huge direct cost for us to contract with Breakthrough, but internally it was a huge indirect cost by having all of our providers, host the workshops and do the follow-up and the screens. And so since you guys have added the Google ads now, it just made sense for us to move to that approach. And it's been successful for us because from an internal management standpoint, the people are calling our offices directly to our front desk staff. So there's really no internal processes that we had to change. So we really, over the last 6 months, moved everything through Practice Promotions. I will say, Neil, when we were on a couple of years ago with Matt, I remember putting a plug into our client success manager. And that's a big thing for us too, because and I know Jess does too. I inundate them with emails. Like they are so good and they're so responsive and they adjust and like they're very short and concise, and they'll basically make any marketing data and analytics like very digestible for me, and I know for Jess too. Like they're amazing and I love them so much. So for us, like it was really important to make everything through Practice Promotions. We could track it. We have people who are really analyzing everything and helping us on the back end. I hope this answers your question. And it seems more efficient. And we also have a much lower cost acquisition per patient than what we were seeing in a couple of years ago. So obviously that's a huge win for us as well, to not have to spend as much money to acquire these patients.
Yeah, perfect. I mean, that's what it's all about at the end of the day, right? You're trying to help more people, get them in, and make sure that you can get the most, people in for the lowest cost possible for that, and make it effective. So I'm glad that we can partner together in all these years and helping you, move forward in the clinics. I just love seeing what you've created there and the growth that you've had, in your practice. So just curious for you here, have there been any specific campaigns or projects that kind of stood out in terms of results there for you?
I think maybe the biggest, and I wasn't
So,
necessarily here for this, but
oh yeah.
what I've heard is that when we had merged with two additional offices, our ortho sports offices, Practice Promotions played a large role in that. And I'll kind of let Sarah expand on that.
Yeah, so a couple of years ago, Ortho Sports was another organization that actually was working with you guys, and we merged as a company all under our Trilogy umbrella, and so they were actually already working with Practice Promotions, but it was a huge undertaking to have to merge all of that digital space, right? So to create one website, to get all of our marketing lists updated, to make sure our newsletters and all of our messaging was correct. So that was super helpful in just terms of the Practice Promotions team helping organize that and just push it out into the public. We did a lot of PR around that. And so that was critical for us to get it right, to get that messaging right, and to let all of our existing patients know, there's no changes necessarily, just a name and, a couple extra offices, but, you can expect the same faces, the same services, no concerns from their end or even in the community. So that was a huge, huge help from Practice Promotions, the team getting all of that
Hmm.
done for us.
Great feedback. Yeah, we mergers happen, right? And that's a great way to expand your practice, is acquiring other practices. But there's a lot of logistics behind that, especially also, like you said, from the marketing side and getting everything kind of intertwined and hooked up so they can be a unified front. So I'm glad that we could play a role in helping that as smooth as possible in that transition.
Absolutely.
And so just kind of wrapping up here, you guys have obviously had a really successful model here, and I'm wishing you much success with that in the future. But any words of advice for our audience out there, parting words, if they're looking about these cash line services into their practice, from your side of it?
I mean, I think,
Yeah, that's a good question. Go
yeah.
ahead, Jess.
I was gonna say, I think just kind of circling back to what Sarah had said, we're like, lean into your staff if there's passion projects, if there's opportunities to expand like on a professional level, just like additional certifications or areas of interest. I think is great, not only for your practice, but just for company culture and just for your staff as well, like from a professional development standpoint. And obviously, if you have a specific need in your community, I know communities can look very different. Maybe do like some assessment there too, and just see like what could be extra impactful in a way.
Mm-hmm. Great advice there, Jessica. Thank you. And Sarah, did you have something you were going to say?
No, I think that was great, Jess.
Wrapped it all up there with a nice bow.
Nothing more to add there.
Excellent. Great. Well, thank you so much for being on the podcast with us here today. I know our audience got a lot of great ideas from things that you've incorporated there. I think that every practice should have a medically oriented gym. That makes so much sense. And you're very visionary and where you've gone with that and the different lines that you brought in. So I think you're the future of where practices are going, and you're already there. So congratulations on all your success.
Thank you.
Well, thank you. And thank you so much for having us again. Maybe we can do this again in another year or so.
Yeah, of course. Love it. Absolutely love it. So thank you. Yeah. And so to all of our audience out there, just make sure that you're thinking outside the box. Where can you take your practice into the future? We're bringing successful practices like Trilogy here to show you that there's so much possibility there and opportunities for your practice to help the public. And so this is Neil Trickett here from the Practice Marketing Podcast. Don't forget to share this podcast if you got a lot out of it with your colleagues. And then also don't forget to subscribe to not only our podcast, but our YouTube channel. And then we have tons of advice for you on our practicepromotions.net website with lots of downloads and unique tips for marketing. So this is Neil Trickett from the Practice Marketing Podcast, wishing you much success in your practice.
A free way for you to support our show is by leaving a 5-star rating and review on Apple Podcasts. It's a chance for you to tell us what you love about the show, and it helps others discover it as well. Just scroll down to ratings and review on your phone and click write a review. Thanks.